Another picture of a cadaver, trachea here, right bronchus, left bronchus. And here we have the lungs. Sometimes we call this like the bronchi tree. Kind of almost looks like a tree in a sense. Maybe upside down tree, but then again, if you look at plants, the root system, as you know, of trees grow up and out. Well, in terms of trees and plants, guess what? The same happens underneath ground. All right. So instead of going up and out, the root system grows down and out. So yes, I can flip this around to make it look like a tree, of course. Yes, we call this a bronchus tree, but I guess maybe, I don't know, I don't think I've ever seen it there, but it also can kind of reflect as, in a sense, on some level or another, the bronchus like root system, but like I said, just reflecting that of a tree there. But a lot of times or anything, you'll really see the bronchus tree just spreading out. Again, trachea, and then the bronchus, primary, secondary, tertiary, and the alveoli. See, the bronchial tree. Now let's talk about bronchitis. The suffix itis simply means inflammation of. So again, you got the trachea, and you have and here's what a normal, all right, bronchi should look. Look at the diameter, all right. Nice, allow air to get in and out. Whereas bronchitis, inflammation of what? The bronchi, plural, or the bronchus, singular, but probably if you have bronchitis, of course, it's going to probably impact several bronchus, therefore bronchi. So you have on some level, it appears as though that there's some vasoconstriction here, small diameter, and mucus. So what can cause bronchitis? Bacterial organisms, viral organisms, a number of things can cause bronchitis. It's just simply inflammation of the bronchial tubes. All right, the pleura, outside right here, lungs there. All right, so we have actually the visceral pleura and the peritoneal pleura. The pleura includes the two thin layers of tissues that protect and cushion the lungs, the inner layer. The visceral pleura wraps around the lungs and is stuck so tightly to the lungs. All right, so that will be, again, the visceral pleura right here in the blue, visceral pleura. All right, whereas the peritoneal pleura is the portion, is the outer portion. So definitely know that. All right, pneumonia. Of course, you've probably heard of pneumonia. Maybe some of you guys might have been affected by pneumonia. Pneumonia is an infection that affects the air sacs in one or both lungs. So of course we have the right lung and the left lung. And actually what happens is that the air sacs can actually gain or acquire fluids or pus. And the healthcare professional, a doctor or nurse, can actually put a stethoscope to your chest, back of your chest or anything, and then feel maybe like some crackling sound, not feel, but hear some crackling sounds as you inhale and exhale. All right, so pneumonia, yeah, so that can be caused by actually a number of different types of bacterial organisms. All right, so again, I think I already talked about here, the alveoli, that's where the blood gas exchange occurs, but of course this can get infected by bacteria that's causing pneumonia. All right, so normal alveoli, all right, and pneumonia. So you see actually like an accumulation of fluid, liquid, and pus. So a little microbiological war going on where that's infected. So your white blood cells, part of your defense system, is fighting it off, and the bacteria is fighting off. Could be like Klebsiella pneumoniae, pneumococcus. I mean, different types of organisms that can be causing pneumonia. All right, so again, we have the alveoli, normal, okay, open, allowing blood gas exchange to occur, and then pneumonia. We have the fluids there. And like I said, of course, as you know, pneumonia potentially definitely can be, can be fatal. So it is potentially deadly, And it's something that needs to be treated and taken care of professionally as soon as possible. All right, thank you.